teenage breast augmentation. First of all, this is something that is a really serious discussion between the teenager and the parents and the plastic surgeon. And often that has to be very, very direct, because certainly if they're obviously 18 or over, they're adults in most states, so it's really up to them. But the options are different for patients that are under age 22. And it's something that you need to really discuss with the parents and the teenager, because if breast enhancement is something that's important, and certainly if they have breast asymmetry, or if they have a lot of bullying at school or in their social venue, then it becomes something like the prominent ears or even a nasal deformity. But breast enhancement at a teenage years is something that you have to take with great seriousness, with the discussion with the patient and the parent. And like I said, after age 18, they're legally, they can make their own decision. But often, when I see a teenager for a breast enhancement, they bring their mother, they bring their parents with them. Usually it's the mom, and it's a team effort, and they want to have it done. And I think that's a good thing. Many times it's because they have significant breast asymmetry, which really is a developmental issue. And I think it's the most common one I do is if one breast is completely misshapen or one is lagged behind the other. And by the way, normally there's no symmetric breasts. Every woman has at least 5 different asymmetries. They're subtle, and I actually wrote that paper in our journal. So everybody has breast asymmetries. That's called normal. So, but if it's significant and they have problems with fitting their clothes in their bras, that's actually, I think, a really important thing. And those are the types of patients that I think do the best. And then those patients, you can actually improve their breast shape and symmetry with breast augmentation. Now, if it's a patient that just wants a pure breast enhancement, that's also a discussion to have. Certainly at 18 or over is when I prefer to have that, because then they're an adult and they can make their own decision. But in patients that are under age 22, at least in the United States, you really can't do silicone implants. You have to do saline implants, and that's just an FDA regulation. Both implants are fine. They both have a silicone outer covering. One is saline on the inside, one is silicone. And the way they're made today, they're very similar, but they only last about 10 years, so that's very important. Okay, so the key is know before you go and have an informed consent, and if you're under 18, you need to have the parental consent. It's a very candid discussion. And see a board-certified plastic surgeon that does this a lot, so they can relate to you and you can relate to them. So these are all important things to discuss with your teenager before you go see a board-certified plastic surgeon, certified by the American Board of Plastic Surgery, does his surgery in an outpatient accredited surgery center, uses an anesthesiologist, and above all, make sure they're an expert in breast surgery and are passionate about what they do, and be compassionate to you and your daughter.